Good afternoon, everybody. I hope you had a good Thanksgiving, and I'm happy to be out of quarantine. Here with Josh and Paul and Fran Rabinowitz, who maybe you know is Executive Director of the Public School Superintendents, and give us a little insight into where we are on schools as we head into December. First, a little bit on the daily summary. It's 3 days worth of numbers, so a lot of cases and a lot of tests over the last 3 days. I think the 4.4% positivity is interesting in the sense that it's another day that's not going up and, in fact, going down a little bit. And we were about 4.7% over the last week, so you can see it's been going down over a week. We were at 5.8% probably a couple of weeks ago. So let's watch the trend line, but that is hopeful. Unfortunately, hospitalizations and fatalities are lagging indicators, and so while positivity is going down, hospitalizations continues to go up. I'd like to see that number going down over the next couple weeks, and then we'll know that we have something really to be thankful for. Fatalities, 59 more people have died due to COVID. I think you see that total number, 5,020. So that's a big number of people who have died over the last 8 months with COVID-related deaths. We have heart disease, we have cancer, and we have COVID in 2020. And these are all members of our family, generally not kids, but their parents and grandparents. And we'll miss them dearly. Next chart, cheer you up a little bit, is hospitalizations and test positivity. That line I told you about, the yellow dotted line there, that's the 7-day average. So we watch that number. It is trending down over a short period of time. And frankly, some of our neighbors are going up, so we have to watch this. The blue line, on the other hand, is the number of people in the hospital. And so you see that number continues to go up with COVID-related beds being filled. Nowhere near where we were back 7 months ago, but still a number to keep an eye on. Hopefully that number will trend down following the testing positivity. This next chart, very colorful, isn't it? Test positivity compared to our other states. I can cut to the chase here. Green is the best, and that's Vermont, and that is Hawaii. But still don't go to Hawaii for Christmas, but it's worth noting. The lighter the color, the better off you are. Those in the yellow, that's Connecticut, and our neighbors like New York and Maine at less than 5%. You can see Idaho and South Dakota, they're north of 30%, just to give you a little perspective of how we are dispersing a bit right now as a country. I guess Washington State, I don't know what they're doing. They're still counting the numbers up there. But this gives you a little idea of where Connecticut stacks up. We're still, probably the 5th or 6th lowest in the country, which is good, and we got to follow those trends. That said, I was sort of interested reading the headlines today, so Josh and Max put this together. What do we do going forward? As you see these trends lines, you see hospitalizations going up, positivity going down, different states doing different things. Dozens of Connecticut doctors have asked us to close the gyms, close down indoor dining. Let's get a lot more severe. Others say, no, gosh, you got to leave the gyms open. You got to leave indoor dining open. It's important for our mental health. It's important for our economic health. I would just say, looking at the numbers for this past weekend, the Thanksgiving weekend, and November in general, you don't have to do a lot by fiat. The people of Connecticut continue, I think, to do the right thing. I worried a lot about people, excess travel over Thanksgiving. We're not going to know the results of Thanksgiving for another week or two, but we do know that rail travel here on Metro North down 85%. We know that driving down about 30%. And this is not corporate related. It's not going to work related. These were, Thanksgiving related. I can tell you people talk about the restaurants and close the restaurants, open the restaurants. The restaurants have worked really hard to stay open and do it safely. It's sort of interesting. Dave Lamont took a look at Open Table, which is the online ordering, to give a snapshot of what's going on. And let's say restaurants were down 3% September 20 to September 2019. Restaurants were down 18% October over October. And restaurants were down 43% November over November. Maybe that's a little bit related to weather. Maybe that's related to people staying closer to home. I say that in the sense that we don't have to do everything by fiat. In many cases, people tend to do what they feel comfortable with, and that's what keeps them safe. And I also urge you to order online and do everything you can to support our restaurants and for takeout and pickup. Similar situation in retail. We thought a lot about Black Friday and Cyber Monday today. It's worth remembering that from the national numbers, retail was down probably 50% on Black Friday. And online shopping is up about 20%. And again, I urge you, I remind you, buy local. You can buy local online. You can do it for pickup, some of it for delivery. It's worth helping out your local merchants. They need it a lot. That's one way you can help. So it's less about what you close and open and more about what you can do in terms of your personal behavior, which I think makes by far the biggest difference. Gatherings, keep them small. Immediate family is safest, 10 maximum. Okay, got a little tight there at Thanksgiving. I appreciate that, but it does make an enormous difference. Over 65, Ned, practice what you preach, but stay safe, stay at home. You are the most vulnerable, and that age group, 65 and above, are the ones most likely to end up in a hospital. We're doing everything we can to keep you safe and hospitalizations down. Maximize takeout, as I said before. Work from home whenever possible. Keep your guard up and wear your mask. I was sort of interested that I just finished up, will probably be one of Vice President Pence's last COVID task force meetings, and we were all on the same page. Everybody was wearing the mask, from the Vice President, everybody around the table, and the governors, unless they were speaking. And I can tell you that President Trump and Vice President-elect Biden don't agree on everything, like not much at all, but they agree on the importance of the vaccinations and taking the vaccination, COVID vaccine, when it's safe, when it's effective. They gave us the good news that is rolling out, about Pfizer. Probably by December 14th, we could get our first 20,000 doses of vaccine there. Probably a week later, we'll get another 20,000 doses from Moderna. 95% effective, which Dr. Fauci was on saying, not only is it safe, it's surprisingly effective. So I think it's on Thursday we'll probably have Deirdre back on to tell you what our vaccination strategy is. And it only works if people take the vaccine. Next up is Step Up Connecticut, other ways that you can, keep us safe and keep making progress on the vaccine. And we need your help in terms of Step Up Connecticut, in terms of your volunteerism coming forward. We have hundreds of people. We need many hundreds more. We need that to serve patients in our hospitals. We need that to support our testing sites, as we said before. We need that to keep our schools open. I was interested that this weekend, Dr. Fauci was very clear. He said, close the bars, open the schools, and you can do it safely. But somebody who can tell us how we can do that safely is Fran Rabinowitz. Fran, as I mentioned, works with all the superintendents. Just today, she met with 20 superintendents remotely, hearing their urgency, doing everything she can to keep the schools open. Fran, any thoughts?
Thank you, Governor, and thank you for having me here today. You are right. I meet with over 100 superintendents every week and remotely in area meetings. And this afternoon, I met with 20 of them, all of whom are trying their very, very best to keep the schools open, because we know that in-person schooling is so effective for all of our kids, but most especially for our youngest kids and our students with disabilities. I would say that they are trying valiantly, and right now, most of the 20 that I spoke with, all but 5 were full in at the elementary level. When I say full in, there's always a number of students whose parents choose remote. And they said they're doing really well with the kids, with the mitigating strategies. The teachers are phenomenal. They've learned new strategies. They've adapted well to this environment. We know, they are telling me, that attendance is better when the kids are in person. Sometimes they're hybrid, 2 days in, 2 days off. And those off days, the attendance is not quite as good as it is in person. They're also saying that if they are forced to close, it's not because of transmission of COVID. It's because they do not have enough staff to cover the classrooms while teachers are quarantining because they've been exposed, et cetera, outside of school. So Step Up Connecticut is a perfect opportunity for us to bring in college students and others that can help us out so that the teacher who is the assigned teacher can teach remotely and another volunteer substitute can come in and teach in person. But we do know that that in-person instruction, we've heard from the kids themselves, it's so important for them to have that relationship with the teacher and the relationship with their fellow classmates. It cuts down on the isolation and some of the issues that have arisen in families because of COVID. It helps them greatly to be in school.
Hey, thank you, Fran. And I did notice that New York City closed their schools, and then parents and kids said, hey, at least for the younger grades, we got to be open, and they are reopening.
Yes.
Fran is sticking around, as is Josh and Paul. Any questions?
Channel 3 Eyewitness News.
Good afternoon, everyone. Going back to the halting gym use and indoor dining, is there a specific number or benchmark the state would have to see to even lead to that possibility?
I think I would look at hospitalizations. I'd look at capacity. I'd see if our ICUs and hospital beds and nurses were being overwhelmed. That would probably say, look, we'll do everything we can to mitigate that. But I don't think we're close to that right now. I sure hope not.
Thank you. And one more question. Today, Rhode Island hospitals are at capacity and field hospitals are opening. Because we're so close, obviously, those are our neighbors. Do you have any concerns about that, Governor?
Well, you saw our capacity numbers, so we're doing a little better than Rhode Island at this point, and we can get those field hospitals up pretty quickly, as we've discussed before. So on my list of concerns, I think we can address that on a timely basis if we had to.
Thank you.
NBC Connecticut.
Good afternoon, Governor. You've always said that you'd lead with science as you made decisions during the pandemic. So when you do receive a letter that, like the one you mentioned off the top, from 35 doctors around the state urging you to close gyms and pause indoor dining and ban social gatherings, how heavily does that weigh on you?
Oh, look, I take that to heart. I'll be talking to the doctors tomorrow. I think Josh helped set that call up. That said, I look around and I see, where are the infections? Are we managing it? Can we bend the curve? Are we doing this in an appropriate way? I could shut down schools, shut down restaurants, lock everything up, and say, let's come back in the new year. But you got to get the right balance going forward. I think we've got a good balance right now, but we can always change course if we have to.
And so if you do feel at some point the necessity to take additional steps, would those suggestions by the doctors, another indoor dining ban or gym closures, be the next logical step?
I think so.
Okay, and then lastly, you mentioned that Deidre will be back on Thursday, but you do have an important ACIC meeting tomorrow to talk about the state's vaccination distribution plan. So what can you tell us today about the status of that plan and how tomorrow's meeting will help finalize how the state moves forward?
I can tell you we got to move pretty fast. We are going to get vaccines. We are going to get it before the end of the year, middle of December. December 14th is a date they're hoping for Pfizer. We've worked very hard with CVS and Walgreens, making sure that they have the distribution in place, focused on nursing homes, and we also can get that out to the hospitals. So my understanding from Deirdre and Reg is that's our near-term priority, and hopefully we'll be able to get that addressed pretty thoroughly over the course of the first month or so.
Thanks for your time.
News 8.
Good afternoon, everyone. Governor, you mentioned the hospitalizations as being kind of that next metric in moving forward now. So I guess what you're saying is we're not really close to it, despite what the healthcare people have indicated. Would you try and be proactive? You mentioned those, having those other facilities set up in advance for more hospitalizations. Is that kind of the next step to what you can do to be proactive?
I think that would be a next step. As we've said, though, we can do that on relatively short order. We haven't had any of the hospitals that I know of ask us for that as yet. But we got the Connecticut Guard and General Yvonne ready, standing by if we need to.
I think two other important points on this topic. The governor's mentioned many times that the first challenge we'll likely run into would be staff, right? Doctors, nurses, the professionals who serve patients and who are on the front lines. That would be the first area we would likely see challenges, not necessarily physical capacity, but from a physical bed space perspective. Recall as well that all of our hospitals are still performing all of their regular procedures, tending to the medical needs of citizens of Connecticut that come up independent of COVID every day. And that's critically important too, because when we delayed care earlier in the spring, that had impacts for people as well. So we're hoping to avoid that, but if pushed, there are procedures that the hospitals would start to curtail and continue to use the beds they have in their hospitals before we get to the field hospital setup. So we're not into that phase yet. Hopefully we don't get there, but hopefully we don't need to use those field hospitals this time around.
Governor, earlier in the pandemic, you talked about kind of the balancing act that this is between the health and also keeping businesses open and trying to help in that regard. In leading, whether it's leading a state, leading a company, or leading a sports franchise, there is kind of a fine line, right, between getting people to buy in and getting people to understand the severity, as opposed to not wanting people to panic. In having to go and take a step backward, would that indicate kind of a desperate times call for desperate measures in your mind?
Well, I like your question in terms of persuasion, first of all. We've got to continue to do our best to tell the truth to the people of Connecticut, why the decisions we make are, we think, in their best interests. And more importantly, remembering that 90% of what we got to do to stop this virus depends on their appropriate behavior. And I'd say so far Connecticut's done pretty well. It's been reflected in the numbers this summer, and we'll find out over the next few weeks whether we can bend the curve a second time.
News 12 Connecticut.
Good afternoon. A few weeks ago, we were seeing lots of reports in Fairfield County of things happening at places with restaurant venues that weren't exactly socially distanced dining, people carousing and socializing. Did the limitations that you put a week or two ago work to nip that, or might you be looking at doing something stricter if you continue indoor dining?
Well, as I suggested from the open table numbers, whether our restrictions cap things, people's general anxiety discourage them from doing a lot of indoor dining. So the reservations, anyway, were way down. That said, it's pretty anecdotal what we've heard from other restaurants right now. I think they're not full. I think they're at less capacity, and I think, sadly for them economically, that's not a good thing, which is why I remind people all the time to do takeout. So I think we've got a decent balance there.
One follow-up, in New York City, it's a pretty big pivot that they've emphasized elementary school and special ed. Could you see, saying in Connecticut, hey, let's keep the high schoolers at home and focus on getting the littler kids into school, or, what do you see developing in that direction?
Well, as you know, we leave that up to local jurisdiction, and I guess I've been a little outspoken on how important I think in-person education is, especially for the youngest grades. So if I was a superintendent, parents are really anxious and I've got staffing issues, you're right. I would think those high school kids who are less likely to be able to cohort, that'd be one that you would probably move to distance first. I would think K through 5, they don't learn as well with Zoom. They need that supervision. They need that interaction. They're much less likely to infect others. I would fight like heck to try and keep those schools open as long as I humanly could do it, and do it safely.
Thank you.
Fox 61.
Hey everybody, Matt Karen here from Fox 61. Governor, hope you had a happy Thanksgiving. And it's good to see Fran on the call today. So this question is to the both of you. I know the state has consistently said that we're not seeing widespread transmission in the schools. And not many people would disagree that in-person learning is best. But we know that schools are not immune to the effects of community spread. And up to 40% of young people can have the virus without having any symptoms. And I believe by the state's own admission, these Binax Now testing kits that are being piloted are only good at detecting the symptomatic cases. So to the both of you, what gives you the confidence to say that a third grade classroom is one of the safest places to be?
You want to start with that?
Yep, I'll be happy to start with it, because we know that when we do quarantine the teacher and the students because they've been in contact with somebody outside of school or whatever, we're not seeing them get sick. We're seeing them remain healthy until the end of the quarantine and come back. So that would tell us that we are not seeing the spread in schools, Matt. It's actually collecting that kind of data and looking at it and saying we're just not seeing that transmission. And I again would give credit to the educators and the leaders for being vigilant on the mitigation strategies.
I just add, as I look around the world, I see Europe has kept their schools open, in particular for the younger grades, in the middle of a very high infection, community spread in their countries, very low infection rates in the schools where they do a lot of testing. New York City, they found that much lower infection rates in the classroom than in the greater community. But as you point out, Matt, we are going to be rolling out more and more of the Binax testing to any of the schools that want it, so we can give teachers as well as students a little quicker response.
And Governor, would teachers be considered frontline essential workers to be first in line for vaccine distribution?
They'd be near the front of the line from my point of view. I'm doing everything I can to give teachers confidence to teach.
All right, and just one more if I could. Maybe this one's for Josh, sort of the data guru here. On the test positivity rate, are retests included in that number? Meaning if someone tests positive, but maybe a week or two later, they go back to see if they are still positive, are they included in that number?
No, you'd only get counted once. If you test positive again on a subsequent test, you're still only counted once. So the Department of Public Health, deduplicates, at the individual level. So there's no double counting, if that's your question.
All right, great. Thank you all.
WTIC 1080 News.
Governor, is it your impression that people are doing the right thing? Was that your report from Thanksgiving weekend? Just from visualizing, a lot of folks were out at the malls, things like that, all weekend, maybe not as many, but is everyone doing the right thing?
I think I got about half of that, but it involved are people doing the right thing. Do you see that anecdotally, looking at malls and the such? You tell me. I mean, we get a lot of calls. We get a lot of calls into 211. We get a lot of calls into public safety. We talk to mayors all the time. And my sense is there are some outliers, and we got to be strict with them, but the vast majority of people are doing the right thing.
Dave, your audio is overmodulated. I can come back to you. We will get back to you later on in the press conference.
Okay, I just turned it down. Is this any better?
No.
Nope.
All right.
The Associated Press.
Good afternoon, Governor. This might be a question for Josh. Can you describe the hospital capacity percentages right now?
Sure. Of our roughly 8,000 licensed hospital beds in the state, they're currently 71% occupied in total. Of our 1,000 roughly ICU beds that are staffed, they're about 59% occupied in total. So as the governor mentioned, just in terms of the overall metrics of physical capacity, we're still, well under our caps. But keep in mind that that's statewide total, so it varies also by facility. Certain hospitals at certain points in time can certainly be feeling a lot more stress than that, and they work together well to try to share patients. But, we are keeping a close eye, obviously, on the percentage of those that are COVID patients because they do require oftentimes a very high level of care that really stresses the system.
I know Yale New Haven Hospital, I think, reported that they only had 20% capacity left. Isn't that a high enough number, Governor, for consideration of more restrictions to prevent capacity from being exceeded?
Well, as Josh said, he used to be chief operating officer. Now he's data guru. But he pointed out that right now, beds are not going to be the limiting capacity. It's going to be people. And what we need to do to get healthcare workers able to roll up their sleeves and help out. We have a fair amount of capacity in terms of a lot of people doing ambulatory and other elective surgeries. They can migrate over to COVID if they have to. Hopefully they don't have to, because it's really important for those folks to have those medical procedures take place.
And just the last question, do you have any data on hospital staffing now, and if are shortages, and what kind of metrics do you have on that?
Do you have that, Josh?
Yes, the hospitals are required to report that to DPH and our federal partners, and several of them have reported staffing shortages in specific skill areas, such as phlebotomists seem to be an area that's in short supply at the moment in several hospitals. So we do watch that carefully with our hospitals.
And are those numbers on the DPH website?
I'm not sure if it's on the DPH website, but we can check. We try to post everything we have out there, so we can take a look at that.
Oh, thank you.
The Waterbury Republican American.
Thanks. To one of Fran's points earlier, and maybe Josh, you might be able to help on this one as well. Is the contract tracing bearing out that teachers and staff members who are contracting COVID-19 are doing so outside of school settings? Is that basically what we're finding, and is that the same for students?
Yes, that's exactly where these insights come from, is from our contact tracing work that's done with our local health departments. Whenever there's a case with a teacher or a student, the health departments swing into action. They do the interviews, they figure out who's been exposed. And as Fran mentioned earlier, when it's someone in a class and they have to self-quarantine for a period of time, when you find out that after that quarantine's over, no one else in that class got infected, which happens nearly every single time, or it doesn't happen, I should say more carefully, no further infections, it gives you good confidence that that classroom is not a source of transmission. And the key factor there to keep in mind, and I've got 2 school-age kids, all of us who have kids know that the big difference in classrooms as opposed to some other places right now is they're incredibly good about wearing their masks. They wear it properly over their nose and mouth. They wear it all the time. Kids are very adaptable. They follow the rules, and they've done a fantastic job, and the results speak for themselves.
Okay, I didn't know whether Fran wanted to comment or not.
I just wanted to say one thing. And, over in the spring, we worried so much, the reopening committee, about how our kids would respond to mask wearing. And Josh is so right. They're so resilient, and they just take it as part of life right now. And I do believe that that is one of the reasons why, one of the major reasons why schools are as safe as they are. The rules are followed in schools to a T, and I think all the worrying that we did was pretty unfounded. Our kids really are wonderfully resilient, and the teachers have done a fabulous job.
In terms of the hospital staffing, Josh, have any hospitals reported a shortage of doctors, nurses? Obviously, phlebotomists are very important in terms of what we're dealing with today, but what about those other positions?
The other area where we've seen some shortages around staffing of testing sites out in the field. We've talked about that in the past, but those are being filled. Not for doctors or nurses yet, but I would just say that it's not to minimize the amount of stress and challenges that are being felt in a lot of our hospitals, our emergency departments, our ICU units right now. Those folks are working extremely hard. The level of hospitalizations we have in this state is much too high. We need to get that down, as the governor said, because it does create a lot of strain on the system, on the individuals. Remember, they've been at this for 8 or 9 months now. Under very stressful circumstances. And so we do worry about that a lot, as the governor talks about almost every one of these press conferences.
And Governor, we've seen sort of a significant uptick, obviously, in all the measures of the pandemic, but it looks like deaths have more than tripled since the start of November compared to what we saw in October. This is 5,000 is another grim milestone, unfortunately, in the state's outbreak. Do you see this? I know it's a lagging indicator, but do you see deaths still ticking up for a while before they subside?
Well, Paul, I'm afraid the models certainly show that, and we see that going on around the country. The only glimmer of good news I would give you is if our infection rate levels off or it starts trending down, you'll see that reflected in hospitalizations and then lower fatalities, hopefully soon.
Okay, thank you very much.
The Connecticut Mirror.
Governor, does the absence of a federal aid package constrain you in any way as far as when you look at whether or not it's time to tighten restrictions?
No, I wouldn't say that. I mean, the lack of federal aid is complicating. We're running through our testing budget that we got out of the CARES Act, and we got to think about that come January. We got to roll out our vaccination plan, which you'll hear a lot more about in a few days. And I'm sorry, the feds just can't make up their mind what to do. So the states are going to have to step up in the meantime. I've got Bob Clark on our team looking at the rainy day fund. This seems to be an appropriate time to use some of those monies to take care of all the medical emergencies that have been necessitated by COVID. But it doesn't impact whether or not you open up restaurants or not.
Well, you had a dig at Senator McConnell today. You compared him to Herbert Hoover. Is it time for both sides in Congress to compromise on the aid package? The Democrats have hung tough, saying if it's too modest a package, they'll never get another shot at a larger one. But there's now seems to be this centrist group working to get both sides to compromise. Do you have an opinion as to whether or not the country would be better off with even a modest package before the Christmas holidays as opposed to holding out for a more significant one?
Yeah, I'd make the deal. I mean, I mentioned to you in terms of vaccinations and testing, and the states are coming up against the wall right now. You've heard a lot over the last few weeks about restaurants need help, and hospitals need help, and universities need help, and not-for-profits need help. And if I bail them all out, then who's going to bail out our states? So the feds have got to do the right thing if you want to fend off what could be a really severe recession. And that's what I was alluding to earlier today. That said, look, let's take something. Let's get going, at least the medical piece of this thing and the small business piece, places where we can agree, and then we'll live to fight another day. Make a deal.
And Governor, this question is for you and Fran. Is a 14-day quarantine still necessary specifically for teachers, given the experience that Fran just pointed out? Dr. Fauci said the other day he defended a shorter quarantine period on the theory that more people are likely to, be honest and to sit out for 7 days. Should we put teachers on the shelf for 14 days when they're exposed, or should we consider something shorter?
I'll start with that if you want, Fran.
Please.
I'm still following the lead of the CDC. CDC is looking over at Europe. Europe said 14 days is more than you need. People aren't shedding the virus, or almost not at all, that final 3 or 4 days. They're doing 7 to 10 days, depending on whether you have a test positive or a negative test in there or not. And I'd like to think the CDC is going to do something similar for us here in the United States. But it's not just teachers, but it's nurses and frontline workers, a lot of whom, if they're no longer infecting, it'd be great if we could get them back helping out.
And I would just follow the governor by agreeing 100%. And I would say there's always silver linings in every crisis we go through. And one of them has been the very close working of the education community with the public health community. And some recommendations are truly CDC public health, and this is one of them. We would look to them for their recommendation.
And last question, Fran, when teachers are self-quarantining, but yet they're not sick, are they teaching online? Are they somehow still helping the systems?
Yes, absolutely. Teachers in most districts, the districts are allowing them to teach remotely. It's always good to have the teacher and have that presence. And then in the classroom, they're hiring substitutes or paraprofessionals to watch the class and help out with those students in person. But the teacher of record, so to speak, is delivering the instruction.
Thank you.
Hearst, Connecticut Media.
Hey, Governor. We're hearing the second wave of the virus could be on track to be worse than the first in terms of infections and deaths. And with the state today tragically surpassing 5,000, do you have a projection for how many people we might get sick or how many we might lose before this is all over?
The models have suggested that it's going to peak in this region sometime in January. Our infection rate, it's based on a very small sample, suggests maybe it'll be a little earlier than that. And obviously the infection rate leads to hospitalizations and sometimes results in fatalities. So that's the best intel I can give you.
And then what kind of demand did testing sites see over Thanksgiving weekend, and what's anticipated this week and closer to the holidays later in next month?
Do you have those numbers, Josh?
Yeah, so somewhat anecdotally, although there was a huge crush of demand for testing in the lead up to Thanksgiving, over actual Thanksgiving weekend, reports were that the demand had come down considerably to levels more resembling several weeks ago, and that there were no reports of large lines or capacity constraints. So I think we experienced, a little bit of a perfect storm in that prior week with a lot of holiday travel coming up, kids coming home from college, et cetera. And we'll see how this week goes, but we may be back to a more normal level of demand.
Thank you.
Connecticut Public Media.
Good afternoon. When we talk about the spread of coronavirus, you said contact tracing goes back to small family gatherings, but we've never heard of transmission through gyms. Do you guys have data that shows there has been transmission through gyms, which made you go back to 50%?
Want to take that, Josh?
Well, we're hopeful that with the institution of the mandatory requirement for masks in gyms, which went into effect last week, that will further help reduce the risk. The thing we always worry the most about is indoor interactions with no masks. Those are the riskiest ones. All the public health professionals tell us that. We haven't seen a lot of cases in Connecticut of transmission in gyms. There have been a number of studies published outside of Connecticut. I mean, a gym in Connecticut is fundamentally going to be similar to gyms in other places. So we do look at trends we see in other states and other research that's done as well. And that's, I think one of the things we follow and it raises some concern and why we put that mask mandate in place last week.
And a question for the governor. Earlier you said that you think Connecticut residents are doing the right thing at restaurants and gyms and that there's no need to put in place anything stricter. But you also answered a reporter's questions who asked, if doctors told you they should be closed, you would. So I guess, do business owners continue to worry that tomorrow the decision could be made that they need to close down, or should they have confidence that until the positivity rate keeps rising, they can stay in business?
The latter. We're going to look at those numbers very carefully. Obviously, the positivity rate, we'll see what the next week or two tells us. I think that will be very illuminating in terms of what, if anything, we have to do further in terms of closing. Hopefully we don't have to. Maybe we're bending the curve with the right balance we've got right now.
CT News Junkie.
Thanks, Max. Josh, this is for you, I think. I wonder if it might be possible for you guys to, to release to us, like, contact tracing results, as in, like, how many cases were related to restaurants or gyms or schools, like, broken down like that. Would that be something that you guys could release?
Yeah, we released some data a couple weeks ago on some of the outbreak investigations that local public health and our state public health departments have performed. We are looking at ways that we could data mine more into the contact database. The thing that we struggle with is that when you have a period of community transmission like this, it's often hard to isolate the exact moment in time where that transmission event occurred. And so we don't want to present data that could be misleading in that regard. And so we are working on how to share more information around that. We agree there would be value to people to be able to see those data and trends. We just want to make sure we do it in a way that's helpful and not confusing.
Right. Could you say, have you been tracking how many infections are related specifically to hospital admissions?
No, not that I'm aware of.
Why was that not one of the considerations?
I'm sorry. So if that's being identified to a contact tracer as where transmission could have occurred, then that would be in the database. But I interpreted your question as, are you kind of uniquely tracking that in particular? Okay.
You spoke earlier that there was just sort of this huge crush ahead of Thanksgiving. Do you have any concerns that that sort of skewed the results these results are kind of encouraging, right? Do you think that some of that came from just folks who probably had no reason to suspect that they were infected getting tested just ahead of the holiday?
No, because keep in mind, for higher ed in particular, we had been doing about over 10%, a little over 10% of our weekly testing over this fall has been from higher ed, testing students at campus. repetitive testing, and the test positivity on those tests tend to be very low. You're testing asymptomatic people over and over again. And that now stops. So actually you should expect, test positivity to increase a little bit with that higher ed testing going away for this month and last week for that matter. So if anything, I would have expected the opposite dynamic as that pauses until January. But certainly it's possible as well that a lot of people traveling for the holidays who weren't sick, weren't symptomatic, got tested last week as well. So the last week was noisy from a data perspective. We'll see what this week brings.
Okay, and one last thing. I think you said that of the 1,000 ICU beds, 59% were occupied. What percentage of that is COVID related?
So 33% of the ICU census is COVID. So about a third of the current ICU beds are COVID positive.
Okay. All right. Thanks, everybody.
The Hartford Courant.
Hey, everybody. This is Emily Brindley from The Current. So, Governor, I have some follow-up questions about that letter that the doctors sent you. So you've said that you would consider additional restrictions based on the hospitalization metrics. But can you explain to me, what are you looking for in those numbers, those metrics, that you haven't gotten directly from hospital staff? Because there's a lot of info in that letter about what the hospitalizations are doing to the hospitals and their staff right now. But that seems like it's not enough for you to add additional restrictions. So what are you looking for in the hospitalization metrics that you haven't gotten already from staff?
Well, certainly capacity and staffing, as we said before. And also, I'm working every day with my fellow governors. I mean, we can close down restaurants in just Connecticut if you think that would make a dramatic difference. We're not sure it would, but we're even less sure it would if we're the only one in the region that does that, Emily. So there are a number of considerations we take as we go through, but I'm hopeful that the curve could bend without us having to take that drastic action.
And you said that in the metrics you're looking at the staffing and the capacity, but what I'm saying is that you have doctors here telling you that their staffing is strained, their capacity is strained, and they're worried. So I guess it just seems like a disconnect there. Like what more can the metrics tell you that hasn't been told to you already by staff? Like, I guess, is there another set of info that you're waiting for? Is there something more what more would you need in order to take that step, I guess, is what I'm really asking.
Well, remember, Emily, I mean, a lot of the beds, as you've heard, are taken up by elective surgeries right now. Last time around, we freed up a lot of nurses and capacity by dialing back some of the elective surgeries. So we do have other ways that we can remediate this without necessarily closing down other pieces of the economy.
And you said that you're meeting with those doctors tomorrow, is that right?
Yeah, isn't that right, Josh? That was
yes.
a yes.
What do you plan to talk about at that meeting, and do you plan to incorporate any of their suggestions into your actual approach here?
Well, it depends on the suggestions, but look, I've spent a lot of time talking to the medical team. As you know, we've had leading medical folks throughout our community who took the lead in terms of all of our opening strategies and otherwise in terms of what we have to do on vaccinations and the such. I've got to, hear their best ideas. That's what I try and do. I mean, obviously, people are stressed. There's a lot of pressure. We've got to listen to that, see if we can address that, and ways that we can address that without necessarily shutting down big pieces of the economy.
And one last question here. New York City plans to test students and staff weekly when they return to schools in December. Do you have any sense of whether or not you would consider instituting a similar policy in Connecticut?
Well, not on a mandatory basis, Emily, but I would say we're moving a lot of the Binax testing, tens of thousands every week to our schools. We're making sure that the federally qualified health centers are available to any teacher or parent that wants their kid tested as well. We'll also probably do what we can to bring testing to the schools, not necessarily on a mandatory basis, but at least make it more readily available for people.
Thank you.
Thank you. All right, I'm getting the signal here from Max. Let me just take a little change of gear. One of our friends recently announced his retirement, and that's Mark Davis. Mark started out as a Cub reporter back in the 1960s, which to most of you is the Ming Dynasty. To Mark and I, it seems like yesterday. He quickly moved from radio to television. Look at that face. That's the face made for TV. And those of us in the political world have gotten to know Mark very well. Known obviously for his exhaustive analysis and exhausting questions, to be blunt. And he brought an awful lot of personality and character to the media team covering the state. And Mark, you're not going far, but we'll miss you, my friend. Take care, everybody.